The UK government says 1 in 50 people in England now has COVID-19. But Boris Johnson's government says its vaccination program is gaining pace. Europe correspondent Nick Dole joins us now from London. Nick, g'day. So some pretty staggering figures about the rates of infections there.
Good morning, Joe. Yeah, that's right. The UK has reported a new record of nearly 61,000 new coronavirus cases and another 830 deaths. And the government says that 1 in 50 people in England currently has COVID-19. And here in London, they say the figure's more like 1 in 30 people. Now, these figures are based not on the people who are coming into big testing centres or hospitals, but this is part of a community survey, a very large one, whereby people are tested at random, and that's, we're told, does give us a better idea of what the actual infection situation is like on the ground. But the good news is that vaccinations are ramping up. The government says that about 1 in 4 people over the age of 80 in England have now received their first dose of a coronavirus vaccine. The government hasn't been all that forthcoming, really, with the exact figures about the people who've been vaccinated over the last month or so. It's been put to the government that that would be a really good thing for public morale if they could see how many people every day are getting the jab. The government says that's something they're working on, but the Prime Minister, Boris Johnson, did provide an update on the figures a little earlier today.
I tell you that this afternoon, with Pfizer and Oxford AstraZeneca combined, as of this afternoon, we've now vaccinated over 1.1 million people in England and over 1.3 million across the UK.
And Nick, still on vaccines, the World Health Organisation's been examining the use of the Pfizer vaccine so far. What's it recommending?
Well, they've made some recommendations about the spacing of the Pfizer vaccine, and we do know that the Pfizer vaccine is one of those that are due to roll out in Australia. Here in the UK, health authorities have changed their strategy. So initially there was meant to be a 3-week break in between the first and second doses. The UK authorities now say that should be a 12-week break. Well, the World Health Organization has recommended that the first and second doses of the Pfizer vaccine really should be given between 21 and 28 days of each other. So that's a much, much shorter window that's being used here in the UK. However, the WHO does acknowledge that there are some circumstances whereby that second dose does need to be delayed, and it says that it is open to other countries coming up with their own strategies. Here in the UK, the strategy is to give as many people as possible access to that first dose, because authorities say even the first dose does give a reasonable level of protection, in fact, a good level of protection, and they say ultimately that will save lives.
Yeah. And Nick, just finally, what are some of the stories you're seeing and hearing there about the pressure that hospital staff are under at the moment, day in, day out, with the numbers of patients that they're dealing with and the number of deaths they're dealing with?
Well, many people say it's unprecedented. We're seeing lines outside hospitals of ambulances, and patients are also being moved to different parts of the country, particularly here around London and in the southeast of the UK. There's a lot of pressure, so they're moving critical patients to other parts of the country. I guess on the plus side, many of the medical staff say that they're getting much, much better at dealing with COVID-19.
Okay.
When they were first having to deal with it, it was a real unknown. They're much better at it now, but that has a cost as well, because all the experience means that they're really exhausted. People haven't had a break, and so it's taking a huge toll on staff emotionally, and many staff have also been infected with COVID-19, so there's huge issues of absences as well in hospitals. But yeah, the next couple of weeks will be critical, we're told.
Yeah, okay, Nick Dole there in London.